Did you know that last year the Census Bureau reported that 49.9 million Americans lacked health insurance? To give you an idea of the magnitude of that number, that's almost the entire population of South Africa. Dallas County alone has 600,000 uninsured people. So what can we do to help, you may ask? Well, let me tell you. We can do our part to help these people access medical care by donating to the community clinics. In particular is City Square Community Health Services. Today I'm going to tell you who City Square Community Health Services is and why you should donate to them in particular. I'm going to tell you about the history of City Square Community Health Services. I'm going to tell you how they deliver quality care, how they focus on preventative health services, how they provide innovative care, and how they're maximizing their resources. City Square Community Health Services started as a volunteer clinic over 10 years ago. They started with volunteer physicians and volunteer nurses coming to employ the clinic, and people would stand outside the door and they will receive care one night a week. Health Texas Provider Network, which is a physician network of Baylor and City Square, decided to collaborate to create the clinic with employees once they saw the need was great. So currently, Health Texas Provider Network provides 2 part-time family practitioners, 1 full-time adult nurse practitioner, and a part-time pediatrician. We also have a pastor and a bishop that do pastoral counseling. We have a diabetic educator that does diabetic education in-house. We have a referral coordinator, a social worker, and then we also have a Class C pharmacy where the patients can get medications if they need to and they can't afford them elsewhere. So City Square provides the support staff, the manager, the medical assistant, the front office, and together, again, they create this clinic for the uninsured of Dallas County. The quality of care is measured by some of Health Texas Provider Network practices that they have. They do audits and they do surveys. So one of the surveys that they provide is a random survey by press gaining. These are surveys that are mailed out to patients randomly, 15 a month, and the patient is to respond how their visit went and if they would recommend the practice or the provider. And so for City Square for 2011, their likelihood to recommend practice and their likelihood to recommend their care provider has been at 100%, which says a lot for the physicians that are providing care for the uninsured of Dallas County. One of the best things that they do is focus on preventative care. Health Texas, again, does an audit on the preventative services that are provided and if they actually are completed. It's one thing to make a referral, but if the test never gets done, then it was really pointless. What Health Texas Provider Network does an audit that says if you really got your test completed. And for the adults, the audit showed that we were at 93% for completed tests, which is #1 across Health Texas. They're also providing innovative care by having group visits, having a community garden, and creating a cookbook. So the patients actually work this garden. They did the planning, they did the watering, they did, found the resources to create the garden. And now, a year later, the patients are actually reaping the benefits because they're getting the tomatoes, the onions, whatever's coming from the garden. And again, they're doing group visits that more than 20 people come at one time with the same illness, and they're able to have that discussion with everyone about, what is your illness, what are you going through. This is things that other clinics aren't doing right now. The patients really enjoy it, and it's also not only helped them with their medical needs, but with their social needs. And then the last thing that they did was they created a cookbook between each other. The patients started to submit their recipes, and they created this cookbook and worked to help get it printed, and now they're providing it. They're selling it to other neighbors that can benefit from these recipes. So City Square is also maximizing their resources by partnering with other organizations, and they're not just trying to do it all by themselves. It shows that they are reaching out and helping the patient get the most possible resources that they can. So they partner with a company called Well Vista that provides medications. They partner with a company called Project Access that helps them access specialists. And then they're just working with other community clinics to not be in competition, but to work together. So today I've told you who City Square is and the type of service that they provide and why you should donate to them. Remember, they started out as a volunteer clinic, and now they have a full staff. They deliver quality care, they focus on preventative health services, they're providing innovative care, and they're maximizing their resources. So the next time you have an opportunity to make a donation, you're aware of a worthy clinic that's doing excellent things to provide great care for people, and it may even be someone you know. Thank you.